Thank you very much, Dr. Babu, for talking to us on Network 18. And I just want to start by asking you about the situation in Karnataka. Cases have gone up in a huge way. There is a lot of concern about Bangalore. The government has now extended the lockdown till May 24th. So, how do you see this panning out? When do you see this peaking?
Yeah, so yes, it is of a concern that the bed capacity is almost near its maximum potential in Bangalore, and also the other districts, at least 10 districts are surging as we speak. Although they had a different beginning of the onset of the surge. So Bangalore started peaking earlier and the other districts have started now. So as a result of that, the focus will probably have to be shifted in terms of saving lives in the districts where the case surge is occurring right now. Bangalore, we are already entering the phase of, somewhere nearer the peak. So the speed of transmission seems to be indicating that we'll have the peak over the next week or so, towards the next weekend. We should be looking at least some models project that Bangalore will see the peak. The cases will still continue to be there because, the way the effective reproduction number works, even if the number of people who are infected from those who are already infected is decreasing, the number of cases will continue to be there. So the priority for critical care beds will still be there, even in Bangalore, till first week of June. That ease won't occur till first week of June, whereas the district headquarters where there is limited capacity for critical care, I think that's where we need to strengthen both in terms of oxygen supply and also how we can sort of redistribute some of the resources internally within the state.
Right. Why do you think the lockdown hasn't had an effect? Because the cases rose by 30% even during the first lockdown. Now the government has extended again, or will it take some time to see the effect of this lockdown?
For any lockdown to have an impact in terms of reduction in number of cases, we'll have to wait at least for 10 to 14 days. The incubation period is only 14 days. So all the infections which have occurred nearly 10 to 14 days ago, they are the ones who are developing symptoms, are getting detected in the initial phase of the lockdown. Now, if we have reduced drastically in terms of preventing the spread from one to another, we should be seeing reduction in cases starting from this week onwards. My only worry is the testing levels will have to remain same. If the testing levels keep going down, then there is noise in terms of whether it is really because of reduction in the transmission or is it because only because of the reduction in testing.
And any reason why, Karnataka or Bangalore is seeing such a big surge? Because in terms of the number of cases, I think it's second only to Maharashtra. And, for the last 1 week, when I see the numbers, it's always at that 48 to 50,000. Bangalore is between 22 to 23,000. In any reason why the second wave has seen such a huge surge here? Like any particular factor?
There is no, I'll have to make this very clear. There is nothing unique to Maharashtra or Karnataka, or for that matter, Kerala earlier, that the cases are higher only in these states and not in the other states. I would want to turn this around and then ask a different question. When we know that these variants of concern are more contagious than the earlier variants, when we know that test, track, and treat is the only strategy for this, why are we not getting similar numbers from other states? That's an important question to ask. The summary here is the states which have more cases are only because they report more cases as a function of testing and case detection. And if some states are not doing enough case detection, or if there's poor testing strategy, then they'll not find enough cases. So I think we should encourage better reporting of cases. So that's the first reason. Second reason is that, we now know that at least there are three imported variants of concern, and there are also
Right.
one or two homegrown variants of concern, which are at least one of them is very contagious. Therefore, we have more cases, and we are bound to get more cases. In addition to that, all the super spreader events are going unchecked in Karnataka as much as in other states. So the fact is the same, and these are the same reasons for high number of cases. So if you don't detect high number of cases, that's a disservice for those who are vulnerable, because without testing them, without treating them, they will not get the deserving treatment.
Right. Dr. Babu, based on your own, modeling and your projections, what scenario do you see for India? Because if you look at the latest report from Lancet, they have said that India could see 1 million deaths by August. We are at 2.38 lakh to 2.5 lakh for now. Most of the states are already, in a state of lockdown, even if the government hasn't announced a national lockdown. Now, 1 million deaths by August is a very alarming number. So, what is your sense in terms of where we are headed, in terms of the number of cases that we are going to see before the second wave peaks out?
See, I think we should be very careful to read the models to the extent only what they can infer on. I don't think any reliable modeling can predict beyond 2 weeks. I have examined several models, but most models look at a horizon of the end of this peak towards the end of May, and early June is when we start receding and start going towards baseline, which means that when there is a surge in cases, generally after anywhere between 5 to 15 days, depending on how much hospital system is able to treat, the surge in deaths occur. So if the people stay in hospital for longer time and the date of death is later, then the death surges occur later. So I don't see a major adverse impact beyond second to third week of June for now, because that's when probably most of the death surge will also reduce. But this is wrong probably to look at the entire national level to infer. There will be some states which might be peaking later, and we need to shift our focus and prioritize saving lives there. But overall, I think we should be out of this. There is rapid ascent of second wave. There should be rapid descent also. And I don't think we should be worrying about a continued wave for really long time. However, as the susceptible pools gets built up, multiple waves are the feature of this virus. And we have seen in Europe, we have seen in US, UK, that there are at least 3 or 4 waves. So we should not dismantle all that we have done, use them, build in mechanisms so that whenever there is another wave, you immediately bring all of these mechanisms into work.
Right. But on the 1 million number, do you think that is a possibility based on what you're seeing now?
No, that is IHME modeling, which the Lancet has relied on. If you look at the modelings done in India, you are looking at maybe by end of this month, 36 million total cases. And even if you look at 1% of them, that will be around 3 lakh, not really 1 million deaths. But we all know that there is undercounting of deaths, under-reporting of. So therefore, what is reported may not be necessarily what's the total. There has to be reconciliation that has to be done. I will not be able to put a figure, whether it will be 1 million or more or less. But what we really need to do is look at the data from crematorium, burial grounds, and the death registration system and strengthen that. Because without counting the death, it is a sort of insult to the entire life of that person. So it is time that we get our reporting systems accurate.
Right. Dr. Babu, the other thing that I wanted to ask was, you said there will be multiple waves before this settles down, and people are, drawing parallels with the Spanish flu, that, that is how it kind of was trending for 2, 3 years. So people are saying that the next wave, the third wave, might impact children more. How do you see this panning out? Because except for Pfizer, which is working on a vaccine for children aged from 2 and above, we don't have anything for children as of now. So how do you see this panning out?
I think we have to go by what the evidence says, and uh, evidence says simply this: the virus will go in search of people who are not infected, which means who are susceptible. Therefore, we are seeing more and more young adults getting infected in the second wave, and this will continue.
Yeah.
The younger age predilection or vulnerability for the infection will continue. But will it be severe or not? At least as of now, looking at the evidence from UK, where there are some papers on 12 years and above compared to the adults, most of the children do well even when they are infected. But that's no solace, saying that even if a minor proportion of children get this multi-system infection, which is like Kawasaki-like syndrome, we simply do not have critical care capacity to take care of that. So therefore, the right strategy is to prevent widespread transmission, and the next strategy is to ensure vaccine trials are done. There's a lot of hopes are on this intranasal vaccine of the Bharat Biotech. Uh,
Bharat Biotech, yeah.
it passes phase 1, and then if it enters earlier into phase 2 and then the clinical trial, then since it induces local immunity and also it's not invasive because it's is intranasal administration, that might have a lot more promise. But we can't jump there one step at a time. We need to first prevent the infections, make sure children are safe, and then see how to tackle the vaccination issue. In the US, they've already allowed it for adolescent age group. Now they are looking at evidence of expanding that to 12 years of age. So if that evidence comes through, Pfizer has already shown interest in coming to India. Maybe mRNA vaccines, at least for the children, might have better hope. So we need to keep all the options open and have as many vaccines as possible. Maybe a differential structure of different vaccines for different age groups. If you're aware, the UK just yesterday said for less than 40 years of age, maybe they can look at other options other than the Covishield. So the national group for the vaccines and the NTAGI should be looking into this.
Right. Also, in terms of this now being airborne, that was another thing that we read in the last few days from the CDC, that it will transmit. The transmission is happening via air, not necessarily through droplets. What impact will that have in terms of the protocols involved, in terms of the behavioral changes that this will necessitate? Have you kind of seen evidence of this in India?
Lancet brought out this article arguing why airborne transmission is one of the useful modes of transmission to consider. The CDC, World Health Organization have always noted that at least in the medical care settings, there is a possibility of airborne transmission. Whether this is a very dominant route, it's completely not clear, because imagine if it were to be airborne in India, would we have had only these many cases, or would there be at least more millions more cases? So that is the distinction that we need to make. So many super spreaders events, religious congregations, poll campaigns. Imagine the number of cases and deaths we should have had if airborne transmission is the predominant route of transmission. I'm not negating, it is still possible, but in settings where closed space is there, in settings where probably for some time it is airborne. But we need detailed studies to establish for how long it can stay. Irrespective of whether it is true or not, I am of the opinion that the strategy won't change. If you wear a mask, and if you wear a good mask, and some experts are even saying double masking, If you're wearing mask and following physical distancing, I don't think there should be any newer strategy, at least for the external settings. For the internal or within closed spaces, we still need to be very careful whether it is airborne or just droplet or fomite. We have to be very careful in closed spaces.
Finally, Dr. Babu, Dr. Fauci in recent interviews has spoken about how India must lock down at least for 2 weeks, 3 weeks, and use that phase to kind of vaccinate at scale. The vaccination rate has also been dropping in the last few days compared to the first week of April when it seemed to be more robust. So again, will this really serve any purpose now? Because if you look at Karnataka, if you look at Tamil Nadu, they have already announced a full lockdown. So will a national lockdown really help when multiple states have already taken measures? And is there something we can do to improve the rate of vaccination apart from perhaps improving the supply?
I I definitely respect whatever opinion Dr. Fauci has for India, and his advice is welcome. But I am of the firm opinion that India does not require national lockdown at this stage, mainly because if you look at Mumbai, it is already coming out of the kind of desperate situation they were in for a long time. Now, the rest of Maharashtra is not same. In Karnataka, Bangalore seems to probably control maybe by next week, but rest of Karnataka will start having increase in cases. Same thing with the other states. States are in different stages of transmission, and they have different kind of resource requirements. I think we should use focused citywide or even district or statewide lockdowns, depending on how much the health system can cater. And if we are using the logic of using lockdowns for ramping up vaccination or supplies, I don't see that happening. I mean, I think those are independent. If you want to vaccinate people, what we need is more supplies. Until we resolve the supply constraints, even if we do a lockdown of 1 month, we are not going to solve it. So I think these are independent issues.
Right. And in terms of the impact on rural India, last year, one of the bright spots was the fact that rural India largely escaped unscathed. Urban working adults, were not that affected. But do you see those coming under pressure now? We are already seeing, working adults in cities getting affected in a big way. But in terms of the signals that you are getting from rural India, the testing also will not be that robust there. Could that again be a ticking time bomb?
Yeah, I think you said it well. Compared to the first wave, I'm really concerned about what happens in rural India now, mostly because this is, at least we know that there are contagious variants, they'll spread faster, especially in the villages where the population density is really high. It can result in many more infections. And again, as you said, the testing levels are inadequate in the rural areas. Health system access is poor in some of the rural areas. So there are already anecdotal reports of higher deaths, unnoticed home deaths in some of the rural areas. So these are concerning. I think as a matter of priority, we have to place our focus on these equity issues, looking at the most vulnerable, most remote, and in the rural areas who require services, and we should step up as a society to cater to their needs.
Right. On that note, Dr. Babu, thank you very much for talking to us at Moneycontrol at Network 18, and please take care of yourself. I think we will be reading more about what you're doing for Karnataka in terms of the modeling going forward. But thank you very much for talking to us. Take care.
Thank you. Bye-bye.